Good evening, everyone. So my next video is on the topic of the effect of drugs, topically applied drugs on rapid side. It is the pharmacology practical. It is the practical topic which we discuss in the pharmacology. It is effect of the topically applied drugs on rapid side. And before I start my video, I want to request you, if this video appears useful to you and if it is helpful to you, kindly subscribe to my YouTube channel, that is Dr. Nitika Pharmacology Discussion. And now I'm going to discuss with you the effect of the topically applied drugs on rabbit side. First of all, I want to discuss that the animal which I'm going to use in this practical is the rabbit, which is also known as the Orbicularis cuniculus, Orbicularis cuniculatus, and its weight is 2 to 2.5 kg, and it can be in this experiment we require some drugs, and in the one eye, in the left eye we instill the normal saline, and in the right eye we instill the drug. And the drugs which we use in this topically applied drugs which we use are parasympathomimetic drugs, that is the cholinergic agonistic drugs like pilocarpine, or anticholinesterase drugs like pyzostigmine, parasympatholytic drugs, that is M3 receptor blockers like atropine, anticholinergic drugs, sympathomimetic drugs, that is alpha-1 adrenergic agonistic drugs like phenylephrine, and local anesthetic drug like lignocaine we will use in this experiment. It means one by one we will instill the drugs in the eye of the rabbit, and in the other eye we will instill the normal saline, and then we will see the effect of these drugs in the animals. First of all, I'm going to discuss with you about the parasympathomimetic drugs. And in this experiment, we will look for the size of the pupil, the light reflux, and the corneal reflux. Size of the pupil, it is demonstrated by the contraction of the sphincter pupillae or contraction of the dilated pupillae, which I have already discussed in the previous video. That is, contraction of the sphincter pupillae muscles will lead to, that is M3 receptor agonism will lead to constriction of the pupils, that is meiosis, and stimulation of the dilated pupillae muscles, that is alpha-1 adrenergic agonistic drugs will lead to stimulation or the contraction of the dilated pupillae muscles leading to mydriasis. And this is I have already discussed with you. And the M3 receptor blockade, that is the relaxation of the sphincter pupillae muscles, will also lead to passive mydriasis. And light reflux is the reflux when we instill the light in the eye of the rabbit, like in the left eye or in the right eye. When we flash the light with the torchlight, there is a closure of the eye, and this is the light reflux. And this is it can be when the light falls on the eye, it reaches the retina, and then which sends signals to the brain, and which sends signals to the oculomotor nerve, which will lead to closure of the eye. And this is the light reflux which we see, and this is basically a parasympathomimetic action. And parasympathomimetic drugs will have the positive light reflux, and parasympathomimetic drugs will have the negative light reflux in them. And corneal reflux is the reflux when we touch the sclerocorneal junction of the eye of the rabbit, there will be immediate closure of the eye will be there. It is the sensory action. When there is stimulation of the sensory nerve with the cotton, we touch the eye, the sclerocorneal junction, there is immediate closure of the eye. And when we stimulate the sensory nerve, it will stimulate the facial nerve, which will stimulate the orbicularis oculi, and that will lead to closure of the eye. That will lead to closure of the eye. And this is the corneal reflux, and this is basically seen in all the drugs like parasympathomimetic, lytics, and sympathomimetic drugs. It is positive, but it is absent in the local anesthetic drugs like lignocaine. But one drug which is cocaine It is the inhibitor of the noradrenaline, so it will lead to increase the release of the noradrenaline, inhibitor of the reuptake of noradrenaline. So it will lead to increase the release of the noradrenaline. So it will lead to stimulation of alpha 1 receptors, or there can be mydriasis by the lignocaine, by the cocaine. Another other drugs like other like local anesthetics, they have no effect on the pupils or size of the rabbit. And now I'm going to discuss with you the with this diagram to study the effect of topically applied drugs on rabbit's eye. This is the diagram. Now, when we instill this is the baseline observation in the first rabbit. When we instill pilocarpine, there will be meiosis because of constriction of the constriction of the contraction of the sphincter pupillae muscles by the pilocarpine, stimulation of empty receptors, there will be meiosis. Light reflux will be positive because this is parasympathomimic action light reflux, so it will be positive, and corneal reflux will also be positive. Physostigmine, which is the anticholinesterase drug, which inhibits the breakdown of acetylcholine. It also stimulates the empty receptors in the sphincter pupillae muscles, leading to meiosis. And light reflux will be again present, and corneal reflux will again be present. Now, baseline observation in third and fourth rabbit will be when we instill the anticholinergic drug atropine, that is a parasympatholytic drug, there will be mydriasis because of the relaxation of the sphincter pupillae muscles and overactivity of the dilator pupillae muscles and sympathomimetic action, there will be mydriasis. And this parasympatholytic action will lead to decrease in the light reflux. There will be decrease in the light reflux. And corneal reflux, it will be present. It will be positive. Corneal reflux will be present. Phenylephrine, which is the which shows the active mydriasis, that will lead to alpha 1 adrenergic agonistic stimulation, leading to contraction of the dilator pupillae muscles and mydriasis. Radial muscles will be contracted. Light reflux will be positive, and corneal reflux again will be positive. And in the fifth rabbit, when we give lignocaine, which is local anesthetic, no decrease in the increase or decrease in the size of the pupil in the right eye will be there. And light reflux will be positive, and corneal reflux will be negative because sensory supply is lost. So sensory nerves will not send stimulation to the facial nerve. And no stimulation of the orbicularis oculi, and no closure of the cornea or the eye will be there. So when we this was all. So when we have to choose any drug, we first of all we have to see for the corneal reflux. If corneal reflux is when we have to choose from any unknown drug, we have to see that which drug it is. First of all, we will see for the corneal reflux. If corneal reflux is present, it means that is the parasympathomimetic drug or parasympatholytic drug or sympathomimetic drug. And if corneal reflux is absent, means if corneal reflux is absent, means there is no closure of these eyes on the stimulation of sensory nerves, that is the local anesthetic. The drug is local anesthetic. So absence of corneal reflux shows that the drug is local anesthetic. And if it is present, then we will look for the light reflux. And if light reflux is present, it means that the drug is parasympathomimetic or sympathomimetic drug. And if a light reflux is absent, it shows that the drug is the parasympatholytic drug, with the action of the parasympathomimetic system. The stimulation of the parasympathomimetic system is responsible for the positivity of the light reflux. And if there is absence of the light reflux, it shows that the drug is parasympatholytic drug, that is the atropine or anticholinergic drug. And now, if the light reflux is positive, then we have to differentiate between the mid, meiosis and mydriasis. If there is a meiosis, it shows that the drug is parasympathomimetic, and if there is mydriasis, it shows that the drug is empathomimetic. That is alpha 1 adrenergic agonistic drug, that is phenylephrine in mydriasis. And meiosis is, then we will say that MT receptor agonist pilocarpine. The drug is pilocarpine, or physostigmine, which is the anticholinesterase drug. That drug is there if there is meiosis. So I hope you understood my video, and if you understood my video, I want to request you that if you like this video, kindly share and kindly like my video, and kindly subscribe to my YouTube channel, that is Dr. Nitika Pharmacology Discussion. Thank you. Be happy, be healthy, be wealthy, be safe. Thank you.